This is the presentation, Reprogramming Your Dysfunctional Reactions with Pro EFT. The more you tap on specific aspects of your dysfunctional patterns, the greater success you will have. This is how dysfunctional patterns get programmed into your life. First, an event happens. Then our mind develops some thoughts to explain what is happening. And these thoughts inform our emotional brain what emotions we ought to be feeling. These emotions are there to urge us to react. We also develop sensations in our body, and they are there to let us know that something is wrong. They turn themselves off when they receive the signal that the threat is over. The first time we go through this process, it takes some time for the body-mind to figure out what to do. And since the body-mind wants to be more prepared for the next time, it checks to see whether to memorize this pattern or let it go. If our emotions are strong enough, this will signal our unconscious mind to record this new pattern. This pattern is now an unconscious reaction waiting for a trigger. Once we have a new program recorded, our body-mind goes on the lookout for any situation that might need this reaction. The unconscious mind cannot evaluate results like the conscious mind can. And over time, the reactions may become dysfunctional because they are being triggered at the wrong times. And once the pattern is set up, the unconscious mind really resists letting us record over these programmed reactions that are supposed to be so helpful. We don't want to forget important things like how to drive or how to eat without getting food in our hair. Sometimes our programmed reactions can be useful like those, but sometimes they can cause all sorts of problems and stress. This news story of someone who set fire to an apartment to kill a spider gives us an opportunity to hypothetically illustrate the components of a dysfunctional response. First, we have the thought that spiders are terrifying. This causes the emotions of fear, anger, and panic, even terror. And this stimulates the urge to destroy, the urge to squeal out loud, and of course the urge to run away. The emotions also simultaneously set off the alarm bells in the body, like rapid heartbeat, throat constriction, the sense of being hard to breathe. The unpleasant sensations will continue to alert us until our body-mind gets a clear signal that we are out of danger. When these reactions are not what we want, and most of those I wouldn't want, like having an intense fear of spiders, we apply the Pro EFT Center solution. So we tap down the intensity of those terrifying thoughts. We're going to tap down the fearful, angry emotions. And we tap down all the urges that are too extreme for the average everyday spider situation. And we also tap down the sensations in the body that are acting as our alarm bells. Once we have lowered these negative reactions, we can tap in the exact reactions we want to experience from now on. Here are some examples of the response a client might want to tap in. This is our new I see a spider functional programmed reaction. Automatically thinking, I don't have to feel terrified if I don't want to. Leaving the option of feeling terrified open, should the situation demand it, adds another layer of safety. It helps negate the what-ifs that can always come up when we successfully put in a new program. Feeling a bit cautious may fit exactly with how you really want to feel when you actually see a spider in real life. You know, most people that are terrified of spiders do not want to feel all warm and fuzzy when they see one. They just want to stop freaking out, especially when one crawls out unexpectedly. We could tap in the urge to find a good solution. That would open up the world of effective actions that would happen automatically and effortlessly. Effective reactions promote our feeling confident, calm, and confident. We could also tap in a calm heart, relaxed shoulders, and feeling peaceful and happy. That signals us that the threat is over. The signal turns off the alarm system that was causing all the problems in the first place. Even though me and my clients and millions of people all over this planet are getting great results with meridian tapping year after year after year, it is important to have some empirical evidence to back it up. And speaking of spiders, here is a peer-reviewed study from the Journal of Clinical Psychology. The study was done in Australia, and that is a great place to find scary little animals. The experiment involved putting a scary animal in a glass cage behind a closed door, and every participant had to be really terrified of the small animal that was in the cage. The study measured how many steps the participants could take walking towards the cage, and this included opening the door and walking into the new room toward those terrifying animals, and they were clearly visible inside the glass cage. They also measured how upset the participants were before the treatment, just sitting there and while walking towards the scary animal. Everybody got a 30-minute treatment. One half the people received a diaphragmatic breathing treatment from a trained psychologist with a specific script. The other half got a 30-minute treatment of tapping with the same exact script. This canceled out the placebo effect since both the groups were getting the same script. The difference in results between the groups was the evidence that the tapping really was making a difference. EFT was 3 to 4 times more effective at increasing the number of steps they could take towards the scary animal, and also how much their emotional stress was lowered. This was strong evidence that the tapping was producing the positive effects. The effects were at the same level of success 7 to 9 months later, when the participants were retested without any further treatment. For those that were clinically minded, the tests they used to measure the results were the behavioral approach test, which measures the progress in changing a specific behavior. They also used a modified version of the Brief Standard Self-Rating for Phobic Patients test, the subjecting units of distress rating scale, and pulse rate. These are scientifically valid instruments of the same categories we have been talking about changing in this whole presentation. They are just put into research terms for this study. This is a second study done 7 years later in North America. In this case, the retest averaged out to about 1 year and 5 months later. The tapping participants kept the same wonderful results without further treatment. This demonstrates that tapping on a dysfunctional reaction and dysfunctional reactions in general, it really changes those reactions reliably. This is not a one-time phenomenon. Tapping isn't the only way you can stimulate the mind to record over the old program reactions to get rid of the emotional pain. This study used propranolol. Propranolol is a beta blocker. Its primary use is in cardiac patients. One of the effects is that it makes the patient feel much calmer in their physical body. And psychiatrists also use propranolol to calm down patients. And in this study, the patients were given propranolol, then given a 20-minute break. And that's for the drug to take effect. So it's calming them down. And then a psychologist would do cognitive behavioral therapy with them on a specific trauma and then measure the results. It worked wonderfully. To quote the study, the fearful reactions to the trauma appeared to be eradicated. And if you were a person suffering from the trauma, not having that traumatic reaction anymore was all the proof you needed. These are the same results advanced certified EFT practitioners get consistently when working with clients. I do feel compelled to add this warning. Please don't experiment with beta blockers like propranolol on yourself. There was a study that was faked in Europe, and the researcher did not do the study at all, but published that he had. These made-up results ended up being used, incidentally, by the same researcher to create a protocol demanding that European doctors add beta blockers to the drug mix with patients without cardiac problems who are going into major surgeries. This study increased the amount of drugs sold, but it resulted in the untimely deaths of 800,000 people in Europe in only 5 years. And no one knows how many people died as a result of this study here in North America. It wasn't a protocol. It wasn't required that a doctor do it that way, but a lot of doctors had read the study and believed it. I cannot emphasize enough that only a skilled physician joining forces with a trained cognitive behavioral therapist are qualified to do these interventions together. But you know what? Luckily for us, lightly tapping on yourself carries no known risk of harm. And here is the English translation of a paper that's been published in South America on people with generalized anxiety disorder. And it was an extensive study comparing EFT to cognitive behavioral therapy with medications. Each group got 12 sessions of EFT, or 12 sessions of cognitive behavioral therapy, while also seeing a physician for psychiatric medications. This study involved 11 different treatment centers with 29,000 patients over a period of 14 years. It was an exhaustive study. Incidentally, the medications with cognitive behavioral therapy group were not getting the timed interventions with propranolol. In the study we were just talking about above, what they were getting was the standard psych meds given to patients with generalized anxiety disorder, and they received their psychological treatment at a different time. Now for the results. 63% of the cognitive behavioral therapy with meds group had improved symptoms. And this is a really high success rate for an orthodox treatment. However, 90% of the EFT group had improved symptoms. And moving on, 51% of the cognitive behavioral therapy group with meds were symptom-free. And in the EFT group, 76% of them were symptom-free. The signs and symptoms of generalized anxiety disorder include thoughts, emotions, dysfunctional reactions, and upsetting body sensations. That's exactly the same group of symptoms that we're addressing in this presentation. The study also had another dimension of testing, EEGs of the participants' brain function. These were done before, during, and after groups of EFT sessions. These were resting state EEGs. The tests were not done immediately after a session, so we're not measuring the results of a session, we're measuring the results of what's happening in the person and their general state of mind. And this is a way to confirm that meridian tapping is actually changing the way your body works physically. The color coding goes from blue to red. Blue is the normal ratio of brain waves, and the red side shows highly dysfunctional ratios of brain waves. These pictures are the averages of the whole EFT group. The ideal brain function is on the upper left. The average brain function before treatment of all these people with generalized anxiety disorders on the upper right. You can see plenty of red and pink in there. And on the bottom, we're going to go from left to right, and you're going to see the results after 4 sessions, after 8 sessions, and after 12 sessions. The dysfunctional reaction patterns of the brain were changed to nearly an ideal brain function, a piece at a time. And so how do you apply all this to your tapping? When you are setting up your tapping routines, first list your upsetting thoughts, your upsetting emotions, the urges to act or shut down, and the sensations you're feeling in your body. And rate them all 1 to 10. Then tapping on the biggest ones first, continue tapping on them until you run out of time, or you get them all down to a 0. But remember, you can tap in feeling better as well. But please don't start tapping in how you want to feel before you've tapped out the things that are bothering you. Almost 100% of the time, that doesn't work. The more you try to cover up your upsetting reactions, the more your alarm systems will try to get through to you. They will attempt to get your attention with ever-increasing intensity. When they are triggered, until you have this gut sense inside that things are okay now. Once you have tapped down your upsetting reactions, then be open to the new ways you are feeling. Add in what you love about these new reactions and the times you remember feeling this way. Then your positive tapping will be very powerful and very effective. It is important to know when to do it on your own and when to book some private sessions. When the emotions are too intense, when the problems are too complex, and when tapping on your own isn't working, These are the perfect times to get some professional help with an advanced certified practitioner. Thank you all for listening, and I'll see you soon.